Thank you so much for the kind words, Nalini. At the outset, let me thank the organizers for giving me this opportunity. Yes, I've become very tall right now. At the outset, let me thank the organizers for giving me this opportunity to speak on a topic which is very close to me personally as well as professionally, sports endocrinology. But a big question was asked, is it relevant? And I'll pose the same question to you at the end of the talk today. Is it relevant? So moving forward, I'd be covering this topic in the following headings. Introduction. E2 is not estrogen, it is exercise and endocrinology in health, exercise and endocrinology in disease, and applications of sports endocrinology, its use and abuse, and then conclusions. So coming to the introduction, we know that endocrine system is a communication system and a slower, longer acting cousin of the nervous system. And it constantly monitors the internal environment and maintains the homeostasis. And it is critical for this, and it acts through the chemicals which we call hormones. And it coordinates and maintains these homeostasis and controls this. It does by controlling the substrate metabolism. Agar raw material milega tabhi company chalegi, right? That way. And then it regulates also the fluid and electrolyte balance. So it does it through the hormones which are secreted in a pulsatile manner, and these hormones typically act to a negative feedback mechanism, which these hormones need to have receptors for them to act appropriately. So what is sports? Sport is an activity involving physical exertion and skill in which an individual or team competes against one another or others for entertainment. At the core of it, it's entertainment, but it is physical activity with skill. It may be either a recreational athletics or it may be a professional athletics. So what is exercise and endocrinology in good health? We know that physical activity, when we term this, what is it? When it is structured, it becomes exercise. When it is unstructured, it is just movement. And exercise, which we often talk about, and we write in the prescription, exercise. How many of you give prescription for exercise in your clinics? Can we see the raise of hands, please? Very good. How many lines do you write? 3 lines, 4 lines? 1 line? 1 word. So what do we talk about it? What do we tell them? Is it aerobic exercise? Is it anaerobic exercise? Or is it resistance training? The patient starts getting confused at this point. We need to first understand what is the relevance of it. What is sports endocrinology to understand and explain this better to our patients. So endocrine system, as I have told you, it controls the substrate metabolism and regulates the fluid and electrolyte balance and coordinates not just in rest but in exercise. So what are the major systems that are affected? What are the major systems? The pituitary gland, the thyroid gland, the pancreas, and the adrenal gland. These are the main tissues which affect, and these affect the raw material supply and metabolism, that is processing of the raw material, that is carbohydrate and fat metabolisms. So what does growth hormone do? It is an anabolic hormone. It builds the tissues and organs. Please remember this because it can be abused because of these same actions. It promotes muscle growth and it stimulates fat metabolism. What do we want? It is creating that perfect biochemical and physiological look in the person. And then we talk about thyroid hormone. We know that it facilitates the metabolism. It increases everything, metabolic rate, protein synthesis, breakdown, number of mitochondria, everything it does. It mobilizes glucose, it mobilizes free fatty acids. So it has a very different effect based on the exercise. A person exercises for a short duration, a short burst. TSH increases and there's a delayed increase of T4. But if the person continues exercising beyond 60 minutes, then that is when T4 becomes constant. It no longer increases and T3 starts decreasing. Different, right? So with exercise, the way the endocrine system is behaving is different again. So we come back to this. We talked about the pituitary and the thyroid. What about the adrenal gland? We know that the adrenal gland has 2 key components, the medulla and the cortex. When there is, suppose imagine there's a lion here suddenly, what do? We run away. There's a flight response, there's a fright response, or we fight. None of us will do that. But then for everything we do, we need muscle action. For the muscle to be acting, it needs the substrate. So an increase in epinephrine and norepinephrine causes a mechanism change in the metabolism, which facilitates up the substrates. That is, glycogenolysis occurs, a lot of glucose is present, a lot of free fatty acids are present, and subsequently there's a change in the cardiovascular system. There's a lot of blood flow to the muscle, which facilitates our running away from the lion. And then there is a heart rate change, contractile force. So much is happening in the body at a span of probably 2 or 3 milliseconds. And then the cortex, it releases glucocorticoids, which again increases the mobilization of glucose via gluconeogenesis and free fatty acid mobilization. So what does pancreas do? Predominantly in exercise, insulin release is decreased. It's the glucagon which increases, which raises the blood glucose level. Why? Because we are constantly burning fuel, and when we are burning fuel, we need again and again replacement of the fuel. So what is happening in carbohydrate metabolism? What are the hormones which increase blood glucose level? There is epinephrine and norepinephrine, glucagon and cortisol which is there. So ultimate aim is for the liver to release glucose and the muscle to use glucose. That is the purpose in exercise. And that is what carbohydrate metabolism change happens in exercise. We also know that based on the duration of exercise, there are other hormones also which are released and which are changing. Growth hormone, it causes increased free fatty acid mobilization. It decreases cellular uptake of glucose. It is saving that glucose for that urgent emergency movement where you need this sudden movement. And then T3 and T4, they definitely increase the metabolism. So the amount of glucose released from the liver depends on two major things. The intensity of exercise. If you're slowly walking versus you're running the same distance, that changes the intensity. And how long are you doing this activity? Again, that says what is the amount of glucose that is released from the liver. With the intensity, catecholamines increase. So glycogenolysis is increased. There's a lot of muscle glycogen that is used. Catecholamines purpose is sudden stress. You have to run from the situation. So muscle glycogen gets used first. With prolonged duration of exercise, it is the liver glycogen which gets used. So you see this graph throughout in this. Is there a point? Throughout in this, you see that the glucose is the one which is almost constant. To keep this constant, there is epinephrine, norepinephrine, glucagon, everything is increasing. The one hormone which increases throughout the activity, irrespective of the duration of the activity, is epinephrine. It constantly allows your muscles to move. It increases the muscle glycogenolysis constantly. So this is how it goes. And when it comes to insulin and glucose, you see that the glucose utilization rate has not changed after the initial change. You see the reverse curve in insulin. Insulin level comes down. So this is what is happening, that hyperinsulinemia which is present, that is coming down, and that is the application of this particular situation in diabetes. So glucose mobilization, we have talked a lot. Anything? We are in Bombay. Nothing goes without mention of Shah Rukh Khan in Bollywood. There's a lot more which is left. So lipolysis, what is happening in fat metabolism? Lipids are much more metabolized right now. You need a lot of energy. Epinephrine, norepinephrine, cortisol, growth hormone. Do you think we're talking a lot of hormones? Do you think endocrinology is there? Is sports endocrinology is relevant? Yes. I'm happy. Right. So what is happening here? Free fatty acids are mobilized, and fat metabolism is critical for not short-term exercises. It's important for endurance exercises. You're doing long runs, going about for 2 hours, 3 hours, a marathon or an ultra run, or going about playing a sport for a very long duration of time. You require free fatty acids for the continuous supply of energy. So that is when the fat metabolism plays into role. When everything is moving, the substrates are moving, everything is happening, there is something which is moving the substrates and playing the major role, that is your fluids and electrolytes. Posterior pituitary, adrenal cortex and kidneys play a major role in fluid and electrolyte balance. You see this. With muscular activity, this promotes a lot of sweating. Sweating leads to loss of blood plasma, resulting in hemoconcentration. Once there is hemoconcentration, there is ADH which is produced. This ADH produced causes a retention in the fluid. So urine output decreases, and then there is an improvement in the hemoconcentration. So the next is adrenals in the kidneys. What is happening? Once there is dehydration, there is a decrease in the blood pressure which is sensed by the kidney. So renin-angiotensin axis is activated. Activation of the renin-angiotensin axis, release of angiotensin causes vasoconstriction. So the blood pressure has improved, first prong. And the second prong is that this angiotensin goes and stimulates adrenal cortex, and aldosterone is released, and sodium reabsorption occurs. So along with sodium, water is retained, so urine output decreases and blood pressure stabilizes. This is the role mainly. And along with doing this, kidney also does one major good action, that is production of EPO. That is erythropoietin. Erythropoietin is very important for endurance athletes and those athletes who train at high altitudes because it increases the RBCs. So what is exercise in diabetes? We all know that lot of things in diabetes. We know that improvement in activity improves glycemic control. It is well known that high intensity activity is much more beneficial than low or medium intense activity, but it is a little riskier in terms of cardiovascular risk as well as muscular injuries. Postprandial energy expenditure is again 45 minutes. These are the clinical points which are very significant and proposed by ACMS. So when the energy expenditure increases in the post-meal state, that is when it has been found that the glucose control throughout the day is very good. And regardless of the type of exercise, regardless of the intensity of exercise, if 45 minutes of postprandial energy expenditure happens, that is when glycemic control is much better. So when your patient in the clinic asks, should I walk after or before? You can tell that you can walk after your food. So this is very important point which is asked clinically many times. So, and breaking up sitting. The sedentary habit has to be broken every 30 minutes. We have to get up, walk around, sit down. At least stretch our muscles. That is what is the recommendation for every 30 minutes. Weight loss again is very essential. And these are the other recommendations which are there. These are the technical recommendations by ACMS about the exercises which we have to do, how much duration one has to walk, how much intensity of walk should be there or exercise should be there, what is resistance training, how much should we do. This is the ACMS guideline 2018 guideline which has been put forth and is being followed right now. So next is applications of sports endocrinology. Right now everyone has agreed that there's enough hormones, there's enough of substrate metabolism and everything happening. So what is the application of sports endocrinology? There is, what do you think is common in these three people? The first bench doesn't get to answer. Eliud Kipchoge, what's common to all these three people? Eliud Kipchoge is the world's fastest marathoner. Shreyas Iyer, you know, is a cricketer. And Team Joe Bar, they are a group of ultra-endurance cyclists who do 5,000, 6,000 miles per month. What's common to them? They all have CGMS. Observe closely. They are all monitoring their fuel requirements. And it is said, a statement given by Abbott, which sponsors Eliud Kipchoge's monitoring, it says that fueling has changed their training technique. Trust me, he has done 42 kilometers under 2 hours. So that's exceptional speed. And for that, refueling is very important. So Abbott says that their training techniques have changed after CGMS. And potentially the outcome has also changed. So sports endocrinology, what is its utility? It helps in athletic performance, helps in prevent injuries in athletes, helps in better hydration, provides new insights to training modules, helps control blood sugars in diabetics, plays an important role in remission of diabetes, helps identify abuse of endocrine principles and doping and anti-doping mechanisms. We'll be hearing a little more about the abuse, so I'll not go into detail. So the use is what we have seen. Abuse is something wherein there is greed and lack of ethics to the use of these principles. Most commonly abused hormones in sports are anabolic steroids, EPO, growth hormone. Doping detection involves profound knowledge of endocrinology and metabolic pathway. Unfortunately, there is nobody in sports endocrinology team right now for the anti-doping team in our country. So it's high time endocrinologists understand that there's a need for their knowledge to be extended in this field also. So conclusions are endocrinology is a core and integral part of sports. Applicational knowledge of endocrinology and metabolism improves training in professional and recreational athletes. And application of knowledge of endocrinology in exercise helps in glycemic control and helps improve health. And doping and anti-doping, it involves endocrine principles at core. So sports endocrinology, do you agree it's important? Do we need to apply it more? Yes. Then let's apply. Let's run tomorrow morning. Who all are coming with me? Awesome. Thank you so much. Questions?